Now we'll quickly try to move to the next aspect in dealing with newborns, and this is a physical examination. They call this the infant or newborn physical examination. So for the infant or newborn physical examination, let's quickly look at things that you shouldn't miss out. Okay, important aspects that you shouldn't miss out. So it's actually a comprehensive assessment of the newborn's health. So typically you perform this within the first 24 hours of life. So as you just give birth to the baby, within 1 day you must have done this. Then you don't do it only at them, you keep repeating, right? So there are a lot of things you are trying to look out for: how the baby is growing, how the baby developed, to see that the baby wasn't born with any conditions. Do you understand? So what are the key things that you shouldn't miss out in newborn physical examination or infant physical examination? You should actually observe the general color of the baby, observe how the baby is posed, observe the baby's activity when there's nothing, like you're not disturbing the baby, what the baby is doing at their spare time, and observe how they are crying, observe the muzzle tone, check if they are distressed. You understand? Their vital signs, you measure their temperatures, measure their heart rate, measure their respiratory rate, you measure the oxygen saturation, you assess for their fever, tachypnea or bradycardia. Then anthropometric measures, you record their weight, their length, their head circumference. They always plot all the values on the growth chart to see how the baby is growing. On the skin, you look out for birthmarks, rashes, sinuses, jaundice, you understand, bruising. Okay. Now the head and neck, you palpate the fontanelles to see that everything is nice. Okay. You look out for if they have a caput succedaneum or cephalohematoma, which are all injuries that you can get as the baby is navigating through the birth canal. Their cranial synostosis. Examine their eyes, their ears, their nose, and their mouth to see that everything is in line. Okay. Then chest and lungs, you observe chest shape and movement. Then you also listen to the words, heart sounds, and also their breath sounds. Then the cardiovascular system, you auscultate for heart sounds, murmurs, rate, and rhythm. You palpate femoral pulses and assess what capillary refill. Then in the stomach, you look out for abdominal distension, then umbilical hernia, then omphalocele. Okay, so you also check out if there's any enlargement of any organ, okay, generally in the stomach. Then coming down to the genitalia, remember we started from the head down, right? So coming down to the reproductive system, you check that there was a normal development of the genitalia, there's no ambiguous genitalia, there's no hermaphrodites. Do you understand? So in males, you check for their testes, check for their scrotum, check for their urethra. In females, you make sure that the labia is intact, the vaginal opening is intact, and see if there's any discharge at all. Then coming to the musculoskeletal system, you check out for the limbs, the spine, the joints. Okay, then you do otolani and Barlow maneuvers, which are very, very important if you want to actually access for hip dysplasias. Okay, so that's what we got for infant and newborn physical examination.